Welcome to episode 6 of Courage Speaks. I'm your host, Sam Sherman. Courage Speaks is brought to you by Courage to Connect, an outpatient mental health center based in Chicago's North Shore, offering therapy, psychological testing, and psychiatry services for individuals of all ages. On today's episode of Courage Speaks, we have the privilege of welcoming Amanda Stephans, who is the Assistant Clinical Director at Courage to Connect. Amanda holds a Bachelor of Arts in Psychology from St. Mary's University of Minnesota and a Master's of Social Work from Loyola University in Chicago. Her role at Courage to Connect further amplifies her impact, guiding both the organization and her patients towards transformative healing and growth. In her sessions, Amanda excels in creating a nurturing environment where her patients feel safe to explore and foster positive change. She is a staunch advocate of cognitive behavioral therapy and employs a strength-based approach, always respecting the unique pace of each individual's journey towards self-discovery and acceptance. Her mantra, "It's okay to ask for help," echoes through her work, offering a comforting reminder of the strength found in vulnerability. Beyond the session room, Amanda's contributions to mental health include developing prevention programs aimed at reducing underage drinking and substance abuse, along with suicide prevention. Her comprehensive experience encompasses supporting teens and adults working through challenges like depression, anxiety, grief, and life transitions, as well as working with children and adolescents in various settings. Today, we'll delve into Amanda's philosophies that underline her practice, her insights on building a robust foundation of self, and the empowering pathways she illuminates for those on the road to self-acceptance and resilience. Join us on this enlightening journey with Amanda Stephans, a guiding force in fostering mental wellness and personal empowerment. And make sure you listen to the end where Amanda has a bonus story to share that she forgot to share during our conversation. You're not going to want to miss that. So anyway, sit back, relax, and enjoy this conversation with Amanda Stephans for episode 6 of Courage Speaks. Thank you so much for joining today, Amanda.
Yeah, no problem.
This is very exciting to get the chance to talk to you in this setting. How you feeling about doing your Courage Speaks podcast interview today?
Not terrible.
Okay.
Just a little nervous, but my sister always listens to podcasts, so I told her I'm going to do it so I can be on a podcast.
Yeah,
so.
yeah. It'll give your sister something to
Now she has to listen to it.
Right, exactly. So tell me a little bit about just kind of your background and kind of what led you to even being at Courage to Connect now, but what were the steps along the way?
Yeah, so I went to school and got my undergrad in psychology. And then after I graduated, I wasn't quite sure what to do with that. Actually, when I got my degree, PsyDs were just starting out as like the new thing. Like you didn't have to go get your PhD, you could get a PsyD and you know what all that meant. And so I wasn't quite sure what avenue I wanted to go down. So I took a couple years off. I did AmeriCorps, which actually brought me to Evanston. And I worked for a scholarship program there that brought kids from the inner city of Chicago, and they lived in a home, and they got scholarships to go to high school up here, and I kind of helped them through all that, learned different skills, was essentially a mom sometimes as a 20-year-old to a bunch of teenagers. And so while I was there, I decided to go back and get my master's in social work. Because I heard a lot more about, social work and the different things you could do with that. It wasn't just counseling, but it was more like the macro perspective. So I could do a lot of cool things with that and work with a lot of different populations.
So you said that initially your undergrad degree was in psychology, right?
Mm-hmm.
But you said that along that way you weren't exactly sure what you wanted to do with that.
Mm-hmm.
Well, if we kind of go even before that, what was attractive initially about just that psych degree?
Well, I always wanted to be a teacher.
Okay.
My dad is a teacher, and so I was like, yeah, I want to be a teacher. I get summers off. I can, work with kids. It seemed like something cool to do. But then in looking at that when I got to college, I really enjoyed the relationship between people. I always get the joke of being a therapist now because my family says I talk a lot, but I listen for a living.
Yeah.
So that kind of was, a different perspective to me of being able to help somebody through whatever they're going through in life, and it might be long term, it might be short term, but kind of getting to be that person to give a different perspective. So yeah, so I decided, I think, to change into more of those like human relationships and kind of understand how the brain works and, the different theories of, development. So I thought that was really interesting.
Something I like to ask, especially just people who have more experience than me, which is really almost everybody, how would you define like the how maybe the field of mental health, or just the word, the term mental health, what was like the, what did that mean to maybe to you? What did that seem like? Where were we at in your, from your perspective, like societally, around maybe the stigmas and all that kind of stuff?
I'd have to say during undergrad, I wasn't very aware of even the term mental health, or that's what you were going into in studying psychology kind of thing. It just was not really, I think, talked about. And then as I transitioned into what do I want to do and think of that relational piece, I think it was just so a part of me that the words were like a stigma,
We're not a stigma?
Yeah. Whereas if I would talk to my friends and they'd ask, how was work? It's like, well, I'm not going to share all this stuff with you because it's pretty heavy for somebody who does it, who's not in the field. But I also found myself, as I got into the work, casually just bringing it up or talking about it, or even checking in on my friends or family more often, just saying like, hey, how are you doing? Which is the smallest thing, but we might not necessarily do that, especially if we see something off, or we're like, oh, hey, you haven't like texted in a while, what's up?
Yeah.
So I think as my career has grown, I guess I have tried to just not make it a thing, or make it that stigma, and just kind of talk about it.
Yeah.
I kind of also like people's faces when I just start bringing up random things, or, I do a lot in suicide prevention and trainings and stuff that way. So to bring stuff up like that and see people's face, it's like, yeah, this is stuff we can talk about.
Right.
Like in a normal conversation. And I have found as I've gotten older, especially in some of those like close friendships, people have opened up or found more comfort in like, hey, let me really tell you what's going on, as opposed to, when you get together with friends, it's like, let's go out and have fun and do whatever, and then you have those one-on-ones and it's like, yeah, I think I'm gonna start seeing somebody, like I really want to talk to somebody about XYZ, and I'm like, that's great,
right?
Yeah. And so it's nice to also be that person that your friends or family or can open up to you and say, hey, so this is what I'm thinking.
As far as that, it's so funny because like that's something that, as I've talked to more and more clinicians and just people in this field, everyone has that thing, it seems, where it's like all of a sudden you become the family therapist, you become, which when you're with your friends, all that kind of stuff. And I've experienced this thing now where like people will come to me and ask something, it's like a friend or family, whatever, and I'll be like, I'll answer as Sam, but I want to be clear, like this isn't, I don't want to be judged by like clinical skills or whatever like that. There's some crossover there, right, in terms of things that maybe ways that we can like just listen in and all that kind of stuff. But in your experience, you said that's something that actually was kind of interesting when that started to happen. Have you kind of more embraced, or or are there still some kind of tricky areas with that?
I think I've started to set boundaries on it.
Okay.
I don't tell certain people what my profession is sometimes, because I got stuck in a Uber one time and I heard their life story and I was like, I'm just meeting a friend for dinner, but I know your whole life story now. So I kind of more cautious about that. But with friends and family, I'm the youngest of 5. And so I have a lot of sisters and an older brother, and we'll get into the, hey, I need your advice. And then I ask the question, do you need my clinical advice or do you need like my sisterly advice? Right. And usually it's a little bit of both. I'll be like, here's my sisterly advice and here's my clinical advice.
Yeah, I like that. There's a way to kind of differentiate.
Yeah. It's kind of like when you call somebody and you're like, do you want advice or do you just want to vent about something? Yeah, exactly. Like just let me know what supports you need.
Because with friends or family sometimes they're just like, when people are asking and they're like, and if you were to break it down, like, do you want friend advice or do you want therapist advice? And it's just like, because I don't think you're going to listen to either of them. I'll say that.
Yeah. I mean, I just had it interesting. I was at a wedding recently and was sharing just with, a friend of the brides about what I do. And they're like, oh, so you're a therapist. And then they like asked me a question, but this was like, they waited like a day into the weekend to then ask. And I was like, yeah, no, they're like, are you okay like with me asking this? And I was like, yeah, no problem. You know, I'm happy to help. And I actually love when people bring up certain like mental health stuff in normal conversation because it just feels natural. Then it's like talking about the football game or something, you know. You're just like, oh, hey, I went to therapy and this is what my therapist said, you know. And I feel you're hearing more and more of that it's just a natural thing, like, oh, hey, do you want to go out to dinner? Yeah, I have therapy on Tuesday, and then like, can we do it on Wednesday? You know. And it's not like oh, you have therapy, like we can't talk about it. It's oh, cool, like it's just a normal, natural thing.
There's opportunities to like normalize it, and it's to this thing where the cliche of like, oh, like this person needs therapy. My mentality is like, I never say that about anybody. I'm always like, my belief is everybody should be in therapy, and maybe for certain people it would be particularly helpful, but everyone should be in it. And so the more that we can kind of work to hopefully moving toward that, which is like these conversations, and I hadn't thought about it that way of like, when we talk with family or friends, and if they do open up to us about something, regardless of how we approach it, it can at least give an opportunity to, like, as hopefully advocates of the field itself, moving the conversation forward, destigmatizing, all that kind of stuff.
Well, and when I was in my undergrad, and I still remember this, even though it was a little time ago, that we had to, in one of our classes, make an appointment with a counselor or a therapist and go and talk to somebody as if we're the client.
Oh, interesting.
And so that experience was very interesting because it was very uncomfortable and also not, you know, like I was like, oh, I can totally talk to this person, but also I'm telling this person stuff.
Yeah. And so, it was just like one, you just
it was just one session to kind of like make an appointment, see what it's like to be on that other side. You know, we're sitting there saying, you know, we're the one in that chair, right? And that can be intimidating for people. And I mean, I like to always approach it as, you're doing all the hard work, I'm just here to help you. Like, I'm here to guide you and support you in what you need.
It's always interesting, that moment of like working with patients where people will sort of be in the space, and when you can almost work to break down the barrier of like, it's not a thing that you just show up to and just like snap your fingers, you know, there's something, we don't say some spell and then all of a sudden, you know,
we don't fix everything.
No, and it's that it takes it, you know, we're doing some work, they're going to be doing work, it's a collaborate, at least that's the way I look. It's like I use that word a lot, of like collaboration, but it's like and then in a way it seems to be like freeing in a way of, it's like, it's not going to just happen. And I think once you get over that hump of like, it's going to take some time, it's going to take work. It's like, oh, so like there is a pathway here. It's just, it'll take, you know, it's a process.
And I always like it. I like to approach it as that conversation, you know, and I tell all my clients, I go, I'm not the expert here. Like, you're the expert in your life. I'm just here to show you maybe a different perspective or show you that different, you know, like you said, path, right? And it's easy for us to sit there and, you know, listen to somebody talk and tell us these things. And I like to say, I'm only going to know what you tell me. You know, I'm the objective perspective. And sometimes, like, it might not be a good fit. And if it's not a good fit, tell me. Like, I will not be offended. I will not, you know, I don't think you're a real therapist until you get fired by somebody or, like, somebody just stops showing up, you know? And it initially, you know, you have that gut reaction of like, what did I do? Oh no, like, what's going on? Because we're human too, you know, like, we're the professional, but we're also, you know, human, and we make mistakes, and we are not going to be compatible with every single person that comes in and needs our help. And I think it's our job to then find them somebody who can help them in that way. Because there's different personalities, there's different specialties people have, and I think that's the important part, to know when to take a step back and say, I really can't help you with this. This is, you know, above my expertise. Let's see who we can, you know, set you up with, that you will have a better connection.
And that's like a challenge, even something that I'm working through, and I know my peers who are recently, you know, are new into the field. It's like that, almost like removing yourself from, it's like an ego thing in some way, because it's like everyone's like, oh, I can work with any, you know, but we're not everybody's therapist. We can't be everybody's therapist. And like you said, like, the best for the client or patient's well-being, sometimes that's going to be somebody else. That could be, you know, so I think to do that though, at least early on, it seems like you have to really be like, this isn't about me, right? This is about figuring out what's going to be the best thing for this, for this person. So, it's fun navigating that stuff though, for sure.
Oh yeah, definitely.
And then I forgot the exact wording of it, but I was talking to somebody a few months ago about like that realization of like, I cannot be everybody's therapist, and that's not a bad thing. That's just the reality of it. So, with some of your background in working in like suicide prevention and in that space, how did you first kind of get involved in that being kind of a specialty, or that kind of being an area of focus?
I was working as a youth interventionist at the time, and I think I saw a lot of youth that I worked with who had either self-harming tendencies or severe anxiety or depression that led to an attempt. And I think it was kind of my own selfishness of like, I don't know how to handle these, like I don't have this background. So I looked into trainings and things like that, and I got connected with the American Foundation for Suicide Prevention, and I went to one of their Talk Saves Lives trainings, and then I did a train the trainer so I could bring it to the communities. And so then I just learned more and more about it, and how do we talk about it? How do we break down that stigma? What are the, statistics on it? Because we also did a youth survey that they do. I forgot what it's called. But they do it in all different high school districts, and there was this increased rise in that, and a lot of it had to do with social media and, that instant gratification of, if my friends are hanging out without me, I'm going to see it, or that bullying or whatever that has that increased mental health issues in all of our youth right now. And it just made me want to learn more and more. And so I started doing that, and then just presented it to a bunch of the elementary schools around the area. And then I even did it for some of our own staff members, because it's just a generic gateway kind of training. So it's not for just clinicians, it's for anybody who just wants to learn more. And I mean, I educated myself more on it because things have changed, and we're talking about getting, rid of that stigma. And we don't say, the language we use, so we don't say committed anymore, we say died from, and even to this day I'll watch TV shows and I'll make a face, and my husband knows it's because they said this, right? And I'm yes. Or they'll say died from, and I get really excited. So I'm okay, it's
progress.
But it is, it's turning into mainstream and all the time. Even the other day I was on the phone with my sister, and she made a comment, and she said, I forgot what she said, but she said something. She goes, "Did I say it right? Did I say it right?" And I said, "Yes, you said it. That's right. That's how you say it." And I mean, we're so used to saying committed because that's how you grew up, or that's how you see things. And so when you start changing language, you have to be very, very intentional on how you do that. And so I would even stop people in conversations if they said it. Yeah. And it's still very awkward and trying to stop to someone and not sounding like I know what I'm talking about,
But it's the way to, and I think it's cool that even your sister, whether or not it was said the right way, the wrong way, whatever, even just questioning it, that's that intentionality of oh, wait a minute, did I say, and then that allows you to think about it then as you move forward with it.
Yeah, and my family didn't do the training. I just talk about it.
Right, exactly. So
it's also cool as people in your life who want to then know and want to speak in that way, And so it's teaching more than just people who are hey, I want to learn this, or I want to come to do it, because we have to hit those people who might be. It's a hard subject. It is.
Sure.
Nobody wants to sit there and talk about it. I mean, I've brought it up at parties when people are what do you do? And I was well, this is what I do. And they're oh, and you just see that face why did I ask this question?
People being uncomfortable talking about it leads to why it's uncomfortable to talk about, right? So to some idea of normalizing those conversations, it's you almost have to normalize a topic that could be considered challenging because it's already been made that over time, right? Does that make sense?
Yeah, well, and I think my favorite thing that I learned over time that I used to way overuse is you have to be comfortable with being uncomfortable.
Yeah.
That's the number one thing I learned in my, schooling is you have to just sit with that uncomfort and push through it. because that's how you become, a better therapist. That's how you become a better person. You have to work through that, and it might be uncomfortable, but you're learning from that uncomfortableness.
Yeah, and I think it's also like a component of like when we're, it's like when you think about like mental health, and the idea is like, is mental health always feeling one way, or always, it's like, well, I don't think so. I think it's a matter of whatever we're feeling to ultimately be able to like allow those feelings when they come up. And I think about it similarly to this idea of like being comfortable with being uncomfortable, where whether it's like in a clinical setting of like if something comes up in a session, or the beauty of supervision, all those kind of things are like the feeling of that uncomfortable, that's not a bad thing. That's just us experiencing something. It's how to then navigate that, how to operate with that, and be ultimately comfortable with that feeling.
Well, and you have to think about it too, is that's essentially what we're asking our clients to do.
Exactly.
Like, you're coming to do something that doesn't necessarily feel all that natural to you.
Yeah.
And you're learning how to, whether it's changing the way you think, or learning certain coping skills that you wouldn't normally do. You're learning these different skills and techniques that might not feel great or whatever at first, but the more you do it, or the more you practice that mindfulness, or that, whatever, the more you get comfortable with it, and it just becomes a part of you.
Something I found myself saying recently is this idea that like, this is not something that we naturally do as humans. Like, we have thoughts, we have feelings, we have emotions, but like in terms of thinking about them or organizing them in some way, like that's not a natural thing, I don't think, for us to do. We've just been conditioned all in one way. So to your point, when we talk about these skills or these different things, it's like the practice of it, it really is a practice of it, because we're going against what's natural to us, of just sort of being like, what do I do with all these things?
Well, and then when you have done it and you're so ingrained and trained that way, it's sometimes almost, I get taken aback, let's just say, when I'll say something to somebody and they go, oh, that's such like a great idea, I never thought of that, and that's my first instinct.
No,
and I was like,
yeah.
How do you not, like, this is, to me it almost is that, like, it seems like it would be that common sense, oh, this is what it is.
It's a great point.
And then I have to remember, oh wait, not everybody knows everything I know, just like I don't know everything everybody else knows.
Exactly.
Like, I always joke that I'm in social services because I do not do math.
I don't either.
I do not, and I hate it. And so that's, I wouldn't do somebody's taxes, but yeah.
I do them. They just get a really hefty fine from the IRS.
Yeah, but
just try it for fun.
But that's kind of the thought process too, and the reality check, which I think as therapists you need sometimes of, oh, this is so, it's such like a special thing to be able to sit with somebody and be trusted, like, and brought into that. And for me, when I see a client get something, especially somebody who's been struggling and they've gotten that, like, they've moved 2 steps forward and then they go 3 back, and it's just like, okay, and then all of a sudden something happens and clicks, and you're just like, oh my gosh, that's great. Like, I can't, like, you did it. And
that's the thing. Like,
that's what we've been working on. And I love to hone in on that when I meet with people, because sometimes we get so like, okay, well, I did this, but like, I still have all this work to do. And it's like, okay, yes, we all have work to do constantly, even as therapists. We don't know everything. We don't take our own advice, so
yeah, definitely.
we have to enjoy those moments and give that praise to them, as well as take some grace.
It's like encouraging progress and encouraging growth, because like, you're right, like that's for the clients or the individuals, it's like, just like us, like we don't always recognize, because we're just living our life, we're not necessarily recognizing when there's progress or in any kind of thing. So when you acknowledge that, it's such a cool feeling when someone will, it's also cool if like they acknowledge, if like all this, that's even another level of it, if they're just like recognizing it themselves, it's like, that's even another step forward.
I was saying, and my favorite too is sometimes when people come in like, I don't really know what to say, and like by the end of the time they're like crying and like, oh my gosh, this was so great, and I really needed this, and I feel really better, blah blah blah. And I mean, those are probably some of my favorite sessions where I'm like, okay, we have no roadmap, like, let's see where we go. And I ask one little question, and you're just like, oh, okay, that touched a nerve, so like, let's spend time on this. And it might be, it's not, you come into therapy and you're like, okay, I'm going to talk about this and this. It's just sometimes it's, hey, how's your week been going?
Exactly.
And then I think with your skills, you know, you're like, oh, I'm going to pick this out because you've
Right.
mentioned this before, and then expand on it.
Mm-hmm.
And that's where you can kind of help that client see, oh, this really was bugging me, but it might have just been the tiniest thing.
Right.
And they were avoiding it.
Yeah. I love that aspect of like when somebody brings something into the room and then all of a sudden I look at it as fair game. I'm like, that's in play, and it's like we don't have,
you said it for a reason.
You said it, and so we can always like explore it if they don't want to. Like that I won't like, but it's in play. Like, you know, we're not inventing anything.
Oh yeah.
Yeah.
And I've said that to people, like, you know, when you're getting the initial information, you're building that rapport, and I mean, I see my therapy style. I know people go and talking to, you know, what do you do CBT? Do you do DBT? Do you do emotional focus? You know, all that kind of stuff. And I'm like, yes, and, you know.
Oh, totally. Yeah.
I just like to meet the client where they're at,
Yeah.
you know, and I try not to, I think, bring that seriousness to therapy. There's time for seriousness.
Sure.
And then there's that time for, I'm gonna make this joke because this client really needs it.
Yeah.
And we have that relationship.
Yeah.
So I can say it and we can go there, you know? And then you see that, like, okay, yep, that's what I needed. Or
Totally.
you make the misstep and you make that joke and you're like, oh, that was not what I should have said.
Yeah, but
and then you repair.
Exactly. And I think the more and more I think about that therapeutic alliance, and even like the research showing that like that's the number one indicator of the process working, I'm like, that's like kind of above everything in some way, because to that point of like, I always kind of go back to that of like, whether it's just strengthening that rapport, that trust, because if ideally you create a space that not every week is going to be something where there's those like initial, like really presenting concern, to put it in quotes, but like when that comes up, it's a space that does feel comfortable, that's a space that's been created. So and like you said, whether a joke lands or it doesn't, there's opportunity either way through that.
Well, and I think that too, that shows clients too that we're humans and we're going to make mistakes, and it's not like I'm sitting here and telling this person who knows everything. It's, oh, they made a mistake, and then I'm going to model that by saying, I'm sorry, like, that I shouldn't have said that, or that's not, you know, I apologize, you know, please help me understand what you were trying to say. And that also shows that I'm not just going to dismiss that I made a mistake and, you know, I know everything. It's, no, I'm showing you my vulnerability and that was my bad.
Yeah.
So now we can repair this relationship, and so you feel more comfortable to share that vulnerability because I was vulnerable in that moment to say, oops.
There's been times in sessions where like I'll say something early in a session, and like later on I'll, like, when there's just like some, you know, we're kind of going back and forth, and I'll be like, I want to go back on something, and I'll say like, you know what, we're gonna throw that out, and like it's never like, hopefully if like there's a report like trust build, it's like no one, they like, we're just. I remember talking to another clinician here about like it's modeling being human. Yeah. You know, it's just like you know.
Yeah. And that's, I think, what those like reframing techniques, like, so this is what I'm hearing you say, and I've had clients who be like, no, that's not what I said, and I was like, okay, then help me understand what you're trying to say, because I clearly am not understanding.
Totally. And that's sometimes when there's like the biggest challenges, but also biggest opportunities of like, you could be exploring something or trying to work and identify a feeling or whatever the case might be, and pick up something else, you know, something else might come up through those, and that just continues, like, it's working together, right? It's and that's okay, like, because you said we definitely don't know everything, far from it. So
and I've even had clients who, I love this, is they have come to me and they say, I'm going to need you to ask some like more prodding questions about this, like, I want to share with you, but they don't want to. They don't know how.
Right.
So it's like, I'm going to need you to do this. And I think that's great, because that's also showing like you're advocating for what you need.
Totally. That's a good,
let me help you do that. Like, let me help you get those emotions out. Let me help you learn how to express them in a safe space, so that when you are feeling those and you're not in therapy for 50 some minutes, that you can express them in a healthy way, or at least know what your coping skills are that are going to help you get through that moment.
Right. It can start in that session to model out. Yeah, hopefully that's the whole idea. I always think about it's 50 minutes a week. Yeah. There's exponentially more time that you have.
Well, and that's the kind of thing when I say, like, whatever you put into therapy is what you're going to get out of
Yeah.
it. Like, you meet me once a week, this is what we talk about, and then you have to do stuff outside of it. And
Right.
I like to give homework a lot, and I always go, you're not being graded. Like, if you don't do it, you don't do it.
Yeah.
But, you know, this is just how much effort you want to put into it, how much time, you know. And I have some who come in who are like, okay, I did my homework, and like XYZ, they just want to talk about it. And then I have ones who are like, I didn't do my homework. I'm going to tell you right now. What was it again?
I don't remember. There was it.
Yeah. They're like, wait, did I have homework?
Yeah.
And it's like, let's check. Let's check the notes, you know? And so it is. It's that initial two you were talking about is, it's that building that relationship, and that doesn't end, you know?
No,
like,
that's ongoing.
It starts with the beginning, like that intake and whatever, and it continues, and it's always in play. It's always in motion, and the more you learn about them, the more you are like, oh, okay, yeah, this is where we're going with this, or hey, how's this going? And I think too, that's also where some of the connecting with your client and your self-disclosure, you know, where it's kind of what you were saying about like, this isn't for me, right?
Right.
So it's, you self-disclose when you are doing it in benefit of the client, you know, like to make them feel better. And especially as a young clinician, that I think is what I struggled with early on, of like, they're going to see me and be like, my experience doesn't mean, you know, whatever, because when I had my first adult client, I think I was in my like early 20s, and I was like, this 50-year-old guy isn't going to listen to me about substance abuse because I've never like gone down that path. And there's still stuff that we connected on. There's still stuff that you can find because we're humans, and we want that connection, and we find it, and then you build off of that. And like, that's where I built it, was being honest and saying, I don't know. Like, I'm not going to pretend to be an expert on this because I've never been through it. However, I have this background, and I can help you maybe see things in a different way.
Right. And I like that you said we're humans, and that in itself, that's going to be a connection no matter what. And it's interesting you mentioned the note on self-disclosure too, because it's like, as a newer clinician in school, that's such like a touchy, you know, everyone's like, what are we supposed to do? And there's, you know, there's different camps. Like, some people it's like never good. Some people are like, it's whatever. And as I've kind of found, it's like, I kind of go against, I think about it is like, it just depends. It like, there could be absolutely opportunities to, I'm like, people have different levels of it. I'm kind of relatively, I'm putting this in quotes, like an open book, in the sense that like, I don't mind sharing things but is it appropriate? Is it clinically appropriate? Now, a lot of times that could be anything from like building that rapport to other things too. Obviously, I mean, for me, it's probably, there's times that it could be done too much, but I also think that, and I'm saying in a general sense, but I think it's just finding that balance, right? And that it just depends. Is it appropriate to, you know, that alliance? Is it appropriate to the goals that are trying to be worked towards and everything like that?
Well, and it's also definitely a shift depending on who you're working with. Like, completely. I work with kids for so long, and so they don't trust me. Like, but if I brought them candy or we played Uno, and like I told them about my dog, like, okay, that's, you know, you can build that in. But then if I'm talking to a 40-year-old woman who's like, you don't have any experience, what are you talking about? So like, maybe I wear my wedding ring, and like, you know, because I know some people who won't wear, if they're married, they don't wear wedding rings. They don't, like, there's, like you were saying, absolutely no self-disclosure about anything. And I found as I've gotten older too, it's, if I share certain things, you can see the person be like, oh, okay, you have more experience, because I think I've shared one thing about like having a kid. So, but I like was very, very like, I went back and forth for a while on this one, and then I was like, I just like mentioned just like in passing as I was talking, I was like, oh, you know, I'm like, when my daughter does XYZ, like blah, 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 and just kept like discussing what the other topic was. And so you could see though in their face, like, oh, this person has a kid, so like that's more credible.
Right. Yeah.
Which I don't know why, but like that was because it's
mm-hmm.
probably a shared experience, or
right.
oh, you know what you're talking about then, because if I'm trying to do parenting advice, but I'm not a parent,
it can
even if I have the experience, mm-hmm. people are going to be like, you don't know what you're talking about.
Right. And I also just think it helps to like, something I think about a lot is like the inherent like power imbalance, right? Like
mm-hmm.
there's nothing we can it's always going to be an imbalance.
Mm-hmm.
But what I try to do is do everything I can to even it out as much as possible. And sometimes just we're humans, like we have like all that kind of stuff. And where appropriate, if there's opportunities, again, where appropriate of self-disclosure, just like, yeah, I'm not like a, I'm thinking of the, what's from the movie Big, the genie from the, like we're not like, we have lives, we're like, and that's part of that human connection of like the authenticity, hopefully, or genuineness. That now I'm getting a Carl Rogers stuff, but
definitely.
Well,
yeah, because then it's like we get sick. We get, like, we go on vacation, or we should, because we should also take care of ourselves. But, it's that, and it's like, I'm not going to be like, I'm going to be out or whatever, and if a client's like, where are you going? I'm not going to be like, I'm not telling you.
Right. Because that's like weird.
It's like, oh, I'm just like, I'm going to Florida. I'm going, whatever. And so I used to, when I started out, be very protective and turn it on the client.
Oh, right. Yeah.
So, especially kids, because sometimes kids can ask a lot of questions.
Yeah.
So I'd always be like, why is that important?
Yeah.
Or like, why does that matter to you?
Yeah.
Just to kind of see like why they want to know those things. And if it's like, oh, okay, then I'll share it with you. Or, oh, that's interesting. And then we go down another path of like, oh, this is why you want to know stuff about other people, because, it gives you that little power control balance of, okay, this person is human. I'm not just like, I know a little bit about them. And then I also have clients who are like, I know I'm not supposed to ask, but I'm just like...
People have said before, like, am I allowed to ask? And I'm always like, yeah, you can... I
don't know if I'll answer, but you can ask the question.
Yeah. Everyone has their different approaches. Everyone has their different experiences with it. But even aside from burnout, just on the pathway to that, or just kind of having a balance of figuring out... Because, again... With all of your roles, I think just at Courage, there's beyond just clinical roles, right? It's like, and with that, what do you do to seek that balance of the work life or the just maybe preventing burnout or navigating that?
Well, if you ask anybody in my life, they will say I'm not great at it.
Okay, great start. That's right.
But I have gotten, I think, a lot better, and I think that helped because in the program I worked in up in Evanston, I lived with the kids. So I was in that house 24/7 as like a 20-year-old. I lived there. Like the staff lived on the third floor. So there was no work-life balance. They were there, I was there, even if I was off, like I'd come in and they'd be like, hey, what's up, and I wanted to be there too. And so as I got older and moved more into like the private sector, tried to figure out like I need to set boundaries and I need to do like certain things where it's like, okay, I'm gonna, like I have my work phone for emergencies, but that's what I'm gonna answer it for, and I have like, these are my hours and I'm not gonna go outside of them kind of thing. That's not to say that I don't. But that's more like in the clinical realm as opposed to like the administrative. Because like as the assistant clinical director, I get to do both sides.
Right.
So I also think I enjoy the piece of that gives me, I think, more in my cup is working with the clinicians. I think there's more instance where burnout happens if I was when I was just doing clinical work.
So now there's more of a balance, and you can, like you said, you can go to either one that's maybe feeling less. Not intense is not the right word, but it's just in terms of like you can go to one or the other at different times. Yeah,
because I did just private practice clinical work previously, and I did all telehealth, and so I was at my house. So like I was in a different room, but I was at my house. And so there was no separation. And I think that got, hard, especially like when COVID happened. I think a lot of people, not just therapists, like have that burnout with work because there isn't another place you go if you work from home. You need that separate space. And so when I came here, I was very clear on I'm really excited. I love that I get to do clinical work still because I think you need that as an admin and leadership position. Like you need somebody who's still doing the work because then you understand your therapists and your clinicians and psychologists better. And you just have to be mindful in like, okay, and then I'm going to do this, or, I'm really glad like I have a work phone because then I don't, I have a work and personal phone.
It's that in itself is a boundary, right? My first supervisor I ever had was because in my clinical internship, I had a big problem. My biggest, maybe not my biggest problem, but a big problem I would have is scheduling clients outside of my hours, because at the time I could do it. And I remembered talking to my supervisor, and she would say, you have to stop doing this, because it's going to, right now you can do it, but it's going to become much harder to do it. And
it catches up to you.
Yeah, if you don't work on that boundary now, then it's just going to be almost impossible down the road. I've still done that, especially with telehealth and everything like that. Yeah. I've gotten better at it than I was, but I think that's the importance of, like, when we talk about boundaries, like to create that. I mean, boundaries is a word that's used a lot, but in a different context. But in the context of working to prevent or navigate burnout or the work-life balance, it's not. The thing I learned is it's not just a thing to say. It's actually something you have to kind of commit to.
And I try to do that too as well. With, like, I take an annual trip to Minnesota to, like, visit my old college roommate and my sister. So every October, that's what I do. Like, no matter what, I call them, like, hey, I'm coming this weekend. Yeah, this is what I'm doing. And that's like what I call my, like, that's my reboot. You know, I just get to spend a weekend with the people I love, hang out, do whatever, and then come back to, like, the real world, you know? I also have family up in Wisconsin, which they joke that I should just move there because I'm always up there.
Yeah.
And that's what brings me joy and what I enjoy doing. So the drive isn't necessarily, like, hard, because I'm going to do something that I love and be with people I love. And that's my, self-care, if you want to say, to kind of help with that burnout. And just being able to recognize it, I think, too, is really important, because I think at such a young age, with being a clinician, I was oblivious to what was happening. And I was like, I'm going to see this person at this time, or hey, I can fit you in whenever, because you wanted to be flexible.
Exactly.
And so I do that a little bit now, but it's more like, okay, I'll see this one person because,
it's much more case to case.
Because, because I also have that other side of it where I'm supporting clinicians, I'm supervising, young clinicians, where I'll share that too. It's kind of that self-disclosure in therapy with supervisees too, of like, hey, this has happened to me before, it's you're not the first therapist to go through this, right?
Yeah.
And I think it's comforting too to hear that from somebody else who's a little more seasoned, of being like, oh, this happens. Like, I've gotten fired from, like, clients, or I've overstepped, or yes, I've, had burnout and just am so exhausted. I just, like, can't, see one more person. And we were even talking about it recently because of the holidays and the end of the year. There is that feeling, especially with therapists. I think, like, benefits are changing and, like, whatever. So clients are trying to get in and also be like, here's my information. So, like, so you want to be supportive of that, and you also want to take care of yourself, because you are trying to switch stuff around, maybe because of Thanksgiving, or when Christmas comes up, people take vacations, so they might be gone for 2 weeks, and you're like, oh, well, I'm going to take a vacation this week, but then you're gone the week before. So it's balancing that and being like, well, I could reschedule and, like, just have a really heavy top week. Yeah. Because, I mean, we just talked about this yesterday.
Yeah. Well, and that's the thing, is I think I had to learn, and I'm still learning this, to be clear, but, like, just because we can do something, there's a difference between if we can do it and if we should do it, or maybe not should is the right word, but, like, yes, like, can we, like, make 1 week really heavy or one day really heavy? It's like, well, yeah, but what's that? That's gonna maybe make things challenging down the road. So, but I like the even just talking about, like, going up to Wisconsin and those things. It's like there's things that you're going to do that bring you joy, and I think that it's easy to sometimes think, like, oh, I can just maybe not go this time or whatever because I can do some work or whatever the case might be. But it's kind of also maybe just staying committed to those things in our life that give us that joy, because if we're not doing those things, then it's probably going to have some kind of effect.
And I think it, like, ebbs and flows too, because I mean, I talk with clients like this all the time, where it's like, you're either doing so much stuff and you're super busy, or there's, like, nothing going on. There's not really a nice balance of that. And I think that happens, as seasons change and things like that. And depending on what's happening in your friends' like relationships, you know, when everybody was getting married, like all summer, every month we had a wedding, right? Mm-hmm. And now it's like, then there was like a year of nothing, and then like it's, oh, everybody's having a kid, you know? And so it's being intentional about that and reaching out and saying, hey, I haven't seen you in a while. Like, do you want to hang out? Or, hey, let's do dinner. Or, I mean, my sisters and I do like hey, let's can we all FaceTime tonight? Like, let's send your availability kind of thing. And
scheduling things.
Yeah.
I think that's the other part of it is my problem is that, as I like to joke, but it's probably more truth in this than I'd like to admit, like my favorite thing to do is nothing. So usually anything that's doing something is going against, is challenging that.
Yep.
I'm trying to get better at it. But I think that scheduling things, because a lot of times it's like if something's spontaneous, it can be hard to motivate yourself to do it. Everyone's different, but reaching out, being let's make this happen. At least it puts more good pressure on the ability to do that.
And I was just talking to one of my other sisters about this, where we, over COVID, we used to have game nights as a family because we're all around the Midwest, and so we would just zoom in and play those Jackbox games or whatever, and it was so much fun. And then we can see each other now, so we don't do it as much, but then we don't get to see each other because we're not all together. It's
not taking that intentional time.
Yeah. So we were we should do that again. That would be really fun. And so it's okay, well, who's going to plan it now? But it's having those conversations, being able to remove yourself, I think, from that work or from that thought pattern sometimes, because it can be exhausting where you're talking to people all day and then you go home and you're I don't want to talk to anybody.
Yeah.
But then you can't not talk to your partner or your kid or whatever.
And I'll have to say it sometimes. I'll get home and I'll be I want to communicate and I can't actually. I can't. So I have to, and it's we have an understanding fortunately now, but it's just tough because I'll get home and I'll be I can't speak now. It's just
it's I need a few minutes. I'm gonna go over here and do my thing, or I'm gonna do my Sudoku puzzle or whatever, and just be, and then I'll come down when I'm ready.
Yeah, exactly.
But it's also surrounding yourself, I think, with people who understand that as well, and you understanding what their needs are. So it isn't, well, no, I don't care, I'm going to talk to you too, and then you can't give that compassion or that attention because you don't have the mental capacity to kind of listen to somebody else who's in your life.
Yeah, and I'll hear myself too. If I go home and I'm listening or trying to listen to something my wife will be talking about, I'll be in my mind, I'm I really want to listen. Sometimes I can't, if it's late at night or whatever, and it's just, but I think communicating that and understanding it's this is something I want to talk about. I mean,
I've done that here before where I was doing all my clinical work and I came in and somebody's hey, I have a question, and they asked it to me and I replied, can you please repeat that? I have no idea what you said. I was I'm so sorry.
Yeah.
I was I was listening, but I didn't fully process anything because I was just in the last 4 sessions I just had,
Yeah.
And so it's being able to take that breath and just advocate and tell people what you need. Because I have found people are very receptive if you tell them what you need, as opposed to just saying you have it all together and you're I understand. And then you're sitting there working on something and go, I don't know what I'm doing.
Right, exactly, yeah.
So you have to be honest and open about that and say, hey, I had a tough day. I know, I want to hear about your day. I'm going to need a minute, and then I'll come down and maybe we can do dinner or something,
Yeah. Just communication. I mean, I know that ends up always being the answer to a lot of things, or at least the first step to a lot of those things.
But it's not easy.
No, it's not. It's not. It's like anything. We talk with clients about this all the time, where it's we'll introduce a thing, but to be clear, this isn't an easy thing. So that's why we're going to figure out a way.
I mean, I see couples, and I even put a cap on that because you can only do so much, I think, couple work or family work or something, because that will, I learned that for burnout, I couldn't see so many people because then it does start to, I think, spill over into your own relationship, and you're wait, nope, I need to set this boundary. That's not what this is. And just put a cap on it and say, okay, this is what I'm going to see 3 couples, and that's it.
And that's what I can and am okay doing, right? So thank you again for taking the time today to talk. I have a couple quick questions here. The first one, in all your experiences, was there a time that you can recall where you first were I'm doing the thing, I'm happy that I'm doing this, or I picked the right thing, the right career?
I can't remember exactly when it was. However, I think it was, I got an email from a client just randomly sharing, all this progress they had made and stuff. And I was so taken aback, I think, because in therapy they teach you, like, you're not going to necessarily see all that stuff, right?
Yeah.
So to see it and to get recognized in that way, which is not why I do it, but
because it's not a normal thing necessarily, but it happens sometimes. Yeah.
It felt so good, and I was like, I did a good job. Like, because we all want that validation, we just don't want to ask for it.
Totally.
And so it felt so great to, like, see that and be like, this is amazing. And I think I got called out for something that was, like, great, and I remember sending it to my family to be like, hey, look at this, like, look at me, I made it, and so it just was really awesome to see that.
Yeah. I like that you said it's like validation that we'd be, I think, all lying if we said that we don't care, because I think we do care about that, but like you said, it's not really a field where we can't really ask, because that's kind of, but we'll sometimes, and even if we're not, we'll acknowledge, like we talked about earlier, we can encourage that progress and see that, observe that, and see that our clients talking about that stuff. But sometimes you'll get an even, more direct way of that.
Yeah. Well, and sometimes, like, after a session, you'll be like, oh, yeah, that was great.
Yeah.
And other times you'll be like, oh, I don't know if that went well.
Yeah.
And so to see, like, hear it from somebody is just, like, amazing.
I remember the first time I ever had a session where I thought that it went really great. I felt really happy and all that kind of stuff. And then the session where it didn't go as great, I remembered thinking, and then I felt like self-doubt, and I was like, wait, no, we can't be doing this. Like, that's like,
I have another one in 10
Yeah, no, exactly. I was sort of thinking, I'm like, I can't think about myself as a therapist based on just going to work in the process.
Yeah, that would be an exhausting.
Yeah, and early on I was like, oh yeah, if it's good, I'm going to feel good. If it's not, if it doesn't, it's like, anyway, that's a whole other thing. Last question. This is something I've asked, I think, in every interview I've done so far. It can be a tough question because I don't know how often we're thinking about this, but the last time that you felt surprised about something that you've learned, something that you experienced, this could be work, this could be life, this could be anything. Anything come to mind if I say, like, the last time that something surprised you?
This is a hard question.
Yeah.
It's not on my notes.
I knew, I was going to say, I know this one won't be on your notes, so.
Surprised. I mean, I can say when I was offered this job.
Oh, really?
Not that I wasn't, like, qualified for it, but I think it was almost validating of, like, the hard work that going back to validation, like, of the hard work that I did of being like, oh, I'm being seen in this, or I think just anytime a therapist here has come up and, like, asked me something or said, like, given me, like, a compliment on whatever, is just, I don't know, it's just such a great connection, and I think it surprises me every time when somebody comes up and they're like, oh, like, thanks for doing this, or thanks for sitting. I'm like, anytime. Like, that's what I'm here for. I'm here to listen to, the therapist and clinicians, and I'm here to help. And so I think it just surprises me, I guess, every time when people are so grateful for it, because that just gives me more joy.
It's like when we're talking either to friends, family, or clients, and, like, if I remember where somebody in a session once said they wanted to write something down that I had said, and I was thinking to myself, what did I say? Like, what was the thing?
Then you immediately
and you're
go
like,
back.
and that happens with, like, when what like resonates, what helps people or whatever, and sometimes it could be surprising of, like, oh, I was just, like, what did I do? Kind of thing.
It's like, oh, I should have written that down too, right? Yeah. I mean, the other thing I would have said is, when we got a golden retriever, and I was like, I'm going to make her a therapy dog, and, like, this would be great, like, this trajectory, and, like, she's going to help so many people, like, bring my dog to work, and then she turns out to have anxiety, and, like, I was like, okay, girl, can't do that now, but she's good now.
What's your dog's name?
Kona.
Yeah. Awesome.
She's a golden retriever, so she just is very excited, when she sees people. She was a COVID dog. Okay. So, like, we took her to the trainings and stuff, but she's got a little more energy in her.
Yeah. We got a dog, foster fail. Actually, tomorrow is a year. And sort of like was rescued from 2 hurricanes, so we got her super anxious, and it's cool because she's still, like, if people see her now, she still is kind of anxious, but we've seen the progress of where she's come.
Right?
Yeah, that was a pretty cool
thing. She's great. She only needs her trazodone in the car.
Yeah.
It's funny when you bring that up, because then I've had other friends who are like, oh, my dog takes trazodone, or my dog takes trazodone, or like, oh yeah, I take trazodone, because like, I'm on the dog drug, right? And so like when you hear people say that, it's just like a funny thing to hear. And just like, yep, see, just bringing it back to just mainstream everything is just.
Yeah.
Just talk about it.
We can relate to the dogs and all that kind of stuff. So. Well, Amanda, thank you so much again for coming on Courage Speaks. How was that experience for you?
It was good. I mean, I hear you do a great job, so you do.
Well.
I'll let your supervisor know.
Thank you. Yeah. We'll see. We'll see how the listeners. I think this was awesome. So.
Yeah. Well, I mean, thank you for having me. It was really nice to be on, and now I can make my sister listen to another podcast, and we'll have another subscriber.
Yes, exactly.
Or 7. I'll get my whole family to listen.
Perfect. Yeah, get the whole crew.
But yeah, you make it really easy to talk, and I have enjoyed listening to the other ones too, and just kind of getting that feel and just hearing more about things. Because on my way up to Milwaukee, I listen to podcasts, so it's an easy you turn it on and stuck in traffic and you just listen to it.
Yeah. Well, you were a great guest, so I really appreciate it.
Thanks, Sam.
Thank you. But wait, there's more. Okay, so bonus courage. Bonus.
Yes. But no, because when I was younger, I think in like 3rd grade, I needed a picture of my mom in my assignment notebook when I went to school, because like I didn't want to go to school, so I had to have a picture. And we always joke, because my mom would be like, you love your dad more, and I was like, well, yeah, if you have attachment issues, just go to high school with your dad, because he was a high school teacher.
I was going to say, so he was a teacher at
my high school. And he started at my high school when I was a freshman. So I had my dad all 4 years. He gave me my only detention. And
was it fair or unfair?
I corrected him on how to pronounce my last name, so he was just showing off, because everybody's like, you gave your own daughter detention. It wasn't a real detention. I just had to like clean his room, which I did most of the time anyways, but we always joked about, like, I had this attachment to my mom that I literally had to have a picture of her in my assignment notebook, and then I make the joke, I was like, well, I went to high school with my dad, so, but I didn't take either of them to college, so.
No one came to you?
Nobody came to college.
How about the picture? So. Did the picture come along?
No, I did not.
Is the picture somewhere?
Maybe.
Okay.
We might have gotten rid of it.
Now I'm so curious though, so you had your dad all 4 years, or where's your dad?
I had him my sophomore year, because he doesn't teach freshmen, so I had him for U.S. history, and then I took a law class, so I had him my senior year.
That sounds like, it's so funny, because I've talked to people who've had parents that worked at the schools or taught them and all that kind of stuff, and I've heard it, like, I never hear like people say like it was fine. I only hear like it was horrible or it was like great. Like I've never heard anything in the middle, because to me it sounds like a nightmare. Now I don't know, like I don't know your dad, I don't know the teach all that kind of stuff, but I will say, like, I'm just thinking about it for myself, and I always think that would be like such a.
I think it would be if your parent wasn't like the cool teacher. Like, I can see that.
So
if it was like, if people didn't like your dad as a teacher.
Hear stuff. Yeah.
But I mean, he gave out candy all the time, or I would go into his room and take candy, and some of my friends would be like, Amanda, and I would just like throw candy at him and walk out. He also was a basketball coach there, I mean, he was involved in a lot of stuff, so it wasn't.
It worked out.
Yeah, and 2 of my sisters went to the same school, so they got him for at least 2 years. But no, it wasn't. It was. When your dad's more popular than you are, though, it's a little intimidating. He knew more gossip than I did, so he'd sit there and, like, tell me stuff.
Yeah.
Or you have to hang out with all the rest of the history teachers at the end of the day while you wait for your dad. So, but it was fine. He's a good teacher.
He was the cool teacher.
Yeah. So, I mean, he's the kind of teacher who would be hard on you, but then give you a pop quiz and all the notes are on the board.
Oh, right. Yeah.
So if you don't look up, you're going to fail.
Yeah, just look up.
Or you would like ask him like, hey, Mr. Miller, what's the answer to number 2? And he would give you the answer, but you would question it because you weren't sure if he really was telling you the truth. Because he's also really good at that. Like, him and my uncle can go back and forth and you believe what they say. And it might be true, but it might be total crap.
and there is some lesson.
And they're like, well, some of it was true. And
Yeah,
like,
exactly.
okay, but yeah, definitely.
Yeah. This is going in a whole other direction, but I had to learn from a young age, like my uncle specifically, and I don't care if he listens to this, he knows that my aunt told me, because we used to talk all the time, and he used to just say stuff that I used to take all the time as fact, because there's no reason not to believe him. And then at some point my aunt was like, oh, he makes up everything, like, just so you know. And then I was like, wait a minute.
Like, I've been telling everybody this for
Yeah, exactly.
like, all this information. Did that cause you trust issues?
Oh, that's a good question. I don't know. I think I think things probably have. That probably didn't specifically, but you know what? Let's start a session.
Yeah.
Well, thank you again.
Sam.
Yeah.
Sam's inner thoughts.
Oh no. Thanks again to Amanda. I had a blast getting the chance to talk to her for the show, and I'm looking forward to having more conversations with her down the road. Thanks as always to John Marikoski for writing and producing our beautiful theme music. And thank you for tuning into Courage Speaks. We want to remind our listeners that the information and discussions presented on this podcast are intended solely for educational purposes. The content provided is not a substitute for professional medical advice, diagnosis, or treatment. It's important to consult with qualified mental health professionals or healthcare providers for personalized guidance regarding your individual situation. While we strive to provide accurate and up-to-date information, the field of mental health is complex and ever-evolving. The views and opinions expressed by the host, guests, or participants are their own and do not necessarily reflect those of Courage to Connect Mental Health Center. For more information about Courage to Connect, please visit www.couragetoconnecttherapy.com. Thanks again for listening. Be kind. Take care of yourselves. That was episode 6 of Courage Speaks. I'm your host, Sam Sherman. Talk to you soon.